Has a total of 652 confirmed cases of coronavirus. Let's take you live to Public Health. It looks like we're waiting for her to start. She will be starting in just a moment. But let's just go over a little bit of the numbers that we've just received from Public Health. Again, for today's update, there are a total of 652 cases of coronavirus in Kern County. We've learned that 234 people have recovered. That number has not changed since yesterday. And again, we've been talking about the pending tests, the number of pending tests in Kern County, how it compares to the state of California. And right now, there are 3,527 tests that are pending in Kern County. That is the most that we've seen since testing started a little more than a month ago. That is up 71 tests since yesterday. So again, that number continues to climb. Again, this is Michelle Corson. She is the Public Information Officer for Kern County Public Health, and she is getting ready to give us an update on the coronavirus crisis here in Kern County. Let's take you out live.
Kern County Public Health, and today we will be providing you with an update on COVID-19 and its impacts on Kern County. The California Department of Public Health, as of the 17th, reports 28,963 cases and 1,072 deaths. Here in Kern County, as of April the 20th at 8:30 a.m., we have 643 cases, 9 non-residents, and 3 deaths. The age categories of our positive cases break down as follows. Ages 0 to 17, 40 cases. Ages 18 to 49, 379 cases. Ages 50 to 64, 160 cases. And ages 65 and older, 64 cases. Of our current positive cases, 384 are isolated at home and 234 are recovered. That is 96% of all of the cases that are either at home recovering or have recovered. So we feel that that's a very positive number to be able to share with you today. For our testing, we have 4,668 that are negative, 2,490 that are pending, for a total of 7,801. We would like to talk about, this is kind of a health tip that has been provided from the California Department of Public Health recently. If you smoke or vape, please consider quitting. Smokers who already have lung disease or reduced lung capacity could be at increased risk of serious illness due to COVID-19. Smokers are likely to be more vulnerable to COVID-19 as the act of smoking means that fingers and possibly contaminated cigarettes are in contact with lips, which increases the possibility of transmission of the virus from hand to mouth. Smokers may also have increased lung disease or reduced lung capacity, which would greatly increase the risk of serious illness. We want to provide an update on the essential businesses and the actions that we have taken locally. We cannot thank our local businesses enough. The majority of our local businesses have complied with the governor's orders regarding essential businesses. However, to date, Public Health has received over 1,879 complaints, has responded to over 1,461 of those complaints of businesses that remain open despite the governor's order. A follow-up inspection of facilities has resulted in 1 law enforcement citation by the Bakersfield Police Department at a local gym. We continue to receive complaints on our website, or individuals can call our 321-3000 to submit a complaint, and we follow up on those on a weekly basis. Finally, we just want to remind our community, let's keep up the good practices that we have all been implementing. We want to remind you, stay at home. If you must leave for if you must leave for essential services, practice social distancing. That means keep at least 6 feet between you and anyone that does not reside in your household. Wear a face covering if you are out obtaining services and you are unable to practice social distancing. And I just want to remind everyone, our call center remains open 7 days a week, 8 a.m. to 5 p.m. And we are here to answer all of your questions. And please visit our website where we have launched our new dashboard to really showcase our COVID-19 cases and all of the trends and the new things that we're trying to really make clear for our community as we continue through this together. And right now, I am going to invite my media to hit *6. And as we all continue to practice social distancing, the media will be calling in and asking me their questions. So if we are all ready, I will refer to the suggested flow of questioning, and I will open it up for questions.
This is Tony Lee, KNCR, and my question would be, when, if you can say so, or if you can estimate it, when will the number of people getting sick here begin to flatten? It looks like we could be a week or two away from that. And the second part of that question is, when it does begin to flatten, would you, at that point, suggest to the governor that we are ready to reopen the economy?
So we are very hopeful that all of the actions that we are taking with social distancing and staying at home will begin to flatten our curve. We are encouraged by the news we are getting from the California Department of Public Health that has indicated that we as a state are beginning to see potential flattening of the curve. However, at a local level, we do know that our cases continue to rise. So it is quite important that we don't let up on everything we are doing. It is more important than ever to stay at home and practice social distancing because we know that's the one thing that can truly flatten our curve. So Tony, as far as when, we're hopeful. So the next week or two, we are hopeful to see our trend and our curve flatten. And when it comes to reopening, we will really be following the guidance of the governor. So when he begins to determine that it is safe for our state, and however he determines that's going to happen, we're going to pay attention to that, and we are going to adhere to those guidelines. Next question.
Thank you.
Hi, Michelle. It's Rob King from KUZZ. How you doing?
Good.
My question is, when we do begin to start reopening in Kern County and in the state, what are some of the first non-essential businesses that are going to be allowed to reopen first?
You know, again, our businesses have been fantastic. We know this is such a trying time for our business, but as far as how and what businesses become the priorities to reopen, we're really, again, going to be deferring to the state on that and following those guidelines. So I know we're all eager and anxious to know, but at this point, we'll have to wait to see what the governor says about that. Next question.
I'll go. It's Ralph Bailey with Kern Radio.
Hi, Ralph.
Morning, Michelle. Are local hospitals using convalescent plasma to treat critical patients? And can you confirm that the majority of patients are Latino, disproportionate to the population? And are you guys going to release any of that information which does not violate HIPAA laws?
So let me start with the first part of your question. If plasma is being utilized in our local hospitals, you would need to inquire with our local hospitals. I do know that Houchin has, publicly been inviting plasma donations to occur. We know that the FDA has guidelines around this that are very specific. So I would just encourage you to reach out to the hospitals to get the answer to that question. And as far as the breakdown of the ethnicity when it comes to disproportionality with COVID-19, locally, we are referring you, of course, to the California Department of Public Health. I don't know if you visited their website, Ralph, but they have a fantastic dashboard and information about the breakdowns of the ethnicity in the state. They are noting that there is disproportionate numbers for our African American population at this time. So that's the information that we're going to have to point you to as far as the ethnicity goes.
But no plans for us to release that locally?
No, not at this time. Next question.
Hi, Michelle. Hi, Brian Wang with 23. How are you, Michelle?
Hi.
Hi. So we noticed that the amount of pending cases in Kern County for COVID-19 makes up just about over 40% of the entire state. Is there a reason for that you guys saw on your end?
No, we definitely are following that and are interested in the way that the cases are reported to us, the negatives and the positives. So we just continue to communicate with our testing facilities to get the most timely, accurate information to all of you. And hopefully over time, those numbers continue to change and we get more results to report out to you rather than them being in that pending category.
Okay.
Any other questions?
Yeah, this is Fiona Davis from Channel 29, and I noticed the public health dashboard is now showing cases by their specimen collection date instead of the date they are reported positive. So the newly reported cases backfill into the date when the specimen was collected. But I was wondering, is there any concern that this is giving the impression that the curve is flattening and local cases are leveling off?
Yeah, we're seeing a lot of conversation around that, the way that we have changed and decided to give you what we feel is the most accurate way to report this out. And if you look in that shaded area on that graph, we really encourage you to look at that is the areas that will be filled out in the near future and kind of look at the trend up until that shaded point so that you won't see an artificial flattening of the curve, so to speak. We're very on in the way we have started demonstrating this data to you. So again, we would just encourage everyone to ignore that shaded area knowing that those numbers will change and those bars will come up once we get those specimen collection dates filled in. But we're very pleased with the way that we've been able to present this new data. It is much more accurate, point in time, as well as overall how we are doing as a community with our positive cases.
Okay, thank you.
Of course.
Hi there, Michelle. This is Karen Hua from KGET 17 News. My question is piggybacking off of Bion's question. Is public health required to report the number of pending tests to the state? And, regarding these pending tests, of course I understand they're done by individual private laboratories and places, but who is going to pressure these labs to process results faster? Because we've seen results come in as late as past 14 days, and that's, past the typical time of self-isolation.
Yes, and what I will reiterate is when it comes to our local testing, we are in ongoing communication. There is no shortage of testing that we're aware of in our community, which is good news. The way in which this is reported back to us, it is mandatory that they report immediately to us the positive cases. So when it comes to the pending cases and the status of those pending cases, we do our best to follow up with these facilities, but it is beholden upon them to give us these timely reports. So what we can just commit to is we will continue the ongoing dialogue that we have on a daily basis with these testing facilities to get the most accurate information on the testing to our community.
And just the first part of my question, are you then required to report the pending tests to the state of California?
Not to my knowledge. We're not required, of course.
And then, Michelle, just thinking back of Karen, is there, do you think part of this may be because there's a variation of tests that have different time periods for when results are generated?
I think there's a whole host of reasons that I'm not able to really confirm or deny for you today. Testing is something that has evolved, as we all know, since the beginning of this, making testing more available, all the different locations that are conducting the tests. So it's certainly a work in progress. What I can commit to you is that we continue to reach out and do the best that we can to get these facilities to report to us timely and accurately on a daily basis.
And then just follow up on the testing. Just to clarify, how do you determine if someone is recovered and no longer infectious? Do they have to be tested again in order to get a negative, or are they just kind of deemed recovered after 14 days?
Yeah, to my understanding, and a lot of times the medical provider is involved in these decisions, but the Centers for Disease Control has guidelines on when persons are considered no longer infectious and ready to no longer be self-isolated. So the guidelines provide an indication for that. I'm not familiar or aware of the need to be retested. But again, the healthcare provider has some say in this, but the Centers for Disease Control has guidelines around that. And after a certain amount of days, that they are no longer considered symptomatic, or infectious. Is there anyone else that hasn't had a chance to ask a question?
Michelle, can I have one final question? It's Ralph again.
Yes, and this will be the last one of the day for everyone.
Have you all examined a relatively low death rate? 3 is too many, but there are other counties like Ventura that have fewer cases, yet have a higher death rate. And statistically, we're one of the unhealthiest counties in the state in terms of cardiovascular disease, high blood pressure, and diabetes.
Yes, having 3 deaths remains tragic for us. 1 death is, of course, too many. We would hope that our rate of having to be hospitalized and our rate of deaths that result due to COVID-19 continue to be low. And that's why I was very pleased at the beginning of this press conference to be able to talk about how many of our cases have already recovered or they're at home in isolation versus a hospital. So we hope that trend continues most definitely. So thank you for that. And I just want to thank all of my media friends for joining me, and thank you to our community. Continue to stay home, continue to practice social distancing, and stay safe. Thank you.
That was Michelle Corson from Kern County Public Health giving us an update on the new numbers that have just come in for Kern County as we continue to monitor the coronavirus crisis here locally. Let's just go over some of those numbers once again. There were 19 new tests that came back positive for coronavirus yesterday. So that means that 19 people between yesterday and this morning received the news that they are in fact positive with coronavirus. There were 120 people that received the news today that they did not test positive for coronavirus. So again, 19 new tests confirmed, 120 negative. That is for a total of 139 tests that were processed within the last 24 hours. Meantime, There were 211 new tests that were taken yesterday. So again, 211 new people were tested for coronavirus within the last 24 hours. Now, again, we keep talking about the pending number of tests, and right now there are 3,527 people in Kern County that are still waiting for their results. And again, some of these tests we've seen have taken more than 14 days, more than 2 weeks to get back to the people who have received, who took their test originally. So again, there is a major backlog. It is about 48% of the total number of pending tests for the state of California. So definitely an issue for Kern County as people continue to wait for their results for coronavirus. So again, these are numbers that just came down from Public Health just moments ago. And of course, we will have more information on our website, kget.com. We'll also have more coming up today on 17 News at noon. But for now, I'm Alex Fisher for 17 News.